Hello and welcome to Skincare Confidential, the podcast supporting the Science of Skincare Summit. The Science of Skincare Summit is an annual educational event occurring in Austin, Texas, September 5th through the 7th, 2025. My name is Dr. Ted Lain. I am a board-certified dermatologist and your host for today. And I'm so excited to interview Dr. Mark Nestor. Dr. Nestor is the director for the Center of Medical and Cosmetic Research in Aventura, Florida. He is also a volunteer professor in both the departments of dermatology and plastic surgery at the University of Miami Miller School of Medicine. But the reason Dr. Nestor is on today, besides being an incredible dermatologist, he's also been with toxins from the beginning. He did some of the seminal research on Botox and has been involved with nearly every toxin that has been approved in the United States thereafter. So I thought it was a great idea to have Dr. Nestor and his incredible expertise on to educate all of us on neurotoxins. And when I say neurotoxins, most of us just think Botox. It's like a commodity, right? Botox, like the Kleenex of facial tissue, right, Mark?
Yeah, absolutely.
Yeah, but really Botox refers to, all these type A toxins that we have available. So I think it'd be helpful just to lay the groundwork of what a type A neurotoxin is, like the chemical structure.
Absolutely. Thanks, Ted. So all the approved toxins, except one that's nobody uses very often, Myoblock, are type A toxins. And they all have exactly the same mechanism of action. And that's really important. There are really three components to a toxin. There is what's known as accessory proteins, and I'll get to that in a minute. And then two components that form the core 150 kilodalton central aspect that does all the work. That's called the heavy chain and the light chain that make up that component. And this is how all these type A toxins work. The heavy chain binds first to the postsynaptic membrane of the neuron, to the SV2 receptor, and is brought in. It forms in a vesicle and it's brought into the neuron. Inside the neuron, there is a disconnection, so to speak, within that vessel of the heavy and light chain, and the light chain is extruded into the cytoplasm. The light chain is what does the work in the cytoplasm. What it does is it cleaves what's known as the SNAP25 protein of what's known as the snare complex. And what that is important with, that's where the acetylcholine vesicles bind inside to get outside the neuron. And if there's nothing for it to bind to, then guess what? The acetylcholine can't get out and the muscle can't contract. So that's really how it works. Now, what's interesting is that the light chain stays in the neuron for up to 10 months. So it's there a lot. But as we know, toxin doesn't last for 10 months. So there are other things that are involved. There's pseudopods that occur. There's upregulation of genes. These are things that are kind of sketchy that we don't know about from that perspective. But that's how all the toxins work. Now, the important thing to realize, and I should say the accessory proteins are there for certain toxins like Botox and Dysport, but for other toxins like incobotulinum toxin, it's just 150 kilodalton. And this is also for Daxi. There's just 150 kilodalton as well as the accessory peptide as well. Now, what's interesting is, therefore, what is the difference for the different toxins? And the difference has to do with two things. It's what we call molecular potency. And molecular potency is something that I've published and all that. And molecular potency could be defined as really the number of active 150 kilodalton units that are available to bind. And the two things that are available, you have to have a number of them. How many are there? Or what is the picograms or nanograms of toxin? And the second is, are they active? So what happens, unfortunately, with toxin is a lot of these either aggregate or essentially get ruined and they can't work. They can't do the job of binding. So number one, you have to have a certain amount of it here, that can be measured in a different way that we'll get into a little later, because that's how you can differentiate it. And number two, they have to be active. They can't be inactivated either from sticking to the side of the vial when we mix it up, or clumping together so they don't get active.
Wow. So that's wonderful. So, and a lot of our colleagues try to compare the potency of toxins by looking at the number of nanograms or picograms of toxin within the bottle. But to your point, that cannot be the only variable that we look at to really be able to compare them, correct?
Absolutely. And molecular potency, this is what I talk about all the time. That's essentially the key. Not that one toxin is better than the other, they
Mhm.
just have different variations of ultimate molecular potency. And what I tell everyone is okay, the ultimate arbitrage of this is what effect you want. And that's so important because two things cannot go together. You can't have significant duration, and you can't have this idea that I want not to have a frozen look. I want
Right.
to be natural and have movement. Those
Mhm.
don't go together. To
Mhm.
have the long duration, you have to have that frozen look. And if you want to have movement, if you want to use less toxin, that's fine. It's what the patient wants, but it's not going to last as long.
And what we found in a lot of the studies, Dr. Nestor, is that there is a dose response curve with the toxin.
Absolutely. And for all toxins, in other words, remember, first of all, you can't compare commercial toxins on their units. They're
Mhm.
all proprietary.
Mhm.
So they use, different models for this, different what's known as LD50s usually,
Mhm.
which is the lethal dose for rabbits or for mice, etc. Okay. And you can't say 20 units of this is comparable to that. There was a study by a guy by the name of Fields who actually started looking at nanograms of toxin and activity. And this was
Mhm.
actually a breakthrough paper because they looked at things like Botox and Dysport and others. And what's happened is that they said, okay, there was actually differences in the number of picograms of toxin in the doses that were approved for glabella. So 20 units versus 50 units at Dysport, et cetera. And that was interesting because that was one variable that said, okay, there was different amounts of toxin in the approved units of these commercial toxins. And it kind of went along with some of the data on longevity as well when you're using those variables.
Mhm. Speaking of longevity, right? We've had some issues with longevity with some of these toxins promising longevity. And remember, for anybody listening that injects toxins, when you think about longevity, it's all based on a median value, right? So there are people that last longer, there are in whom it lasts longer, and there are always people in whom it doesn't last as long. So we can never promise longevity no matter what we're talking about.
Absolutely.
Yeah.
Now, what's
And
so interesting here is that we just went over this. We had a big meeting in Paris, and you were there at
Mhm.
IMCAS. And
Mhm.
one of the observations that's being made, and this was a study that was done in Israel, is we constantly see some patients now who feel that they're not getting the same longevity in their toxin. Okay,
Right.
they are not necessarily non-responders, but they don't respond as well. And the Israeli study showed something very interesting. They showed that after COVID, and it wasn't clear whether it was COVID or the vaccine because everybody had both,
Right.
people for some reason had shorter duration of the effect of the toxin.
Interesting.
So the question really arises of what is modulating this? And the thought process has always been immunity, or no, in other words, antibodies that were affecting the toxin. That doesn't seem to be the case because when you test these people for antibodies that are less responders, they don't test positive. Now, that could mean that there are other antibodies that are out there that we are not testing for, but it's probably of other combinations where the body is upregulating the system, so to speak, to kind of battle the effects. The body doesn't like when it's not working properly, and it
Right.
does anything it can to undo those effects.
That is so interesting. Yeah, one would assume it would just be neutralizing antibodies.
Doesn't seem to be the case.
Interesting. And so now, Mark, we've got all these different toxins that are already available to us, right? And I'm going to say brand names here, and we kind of are interchanging brand names and their chemical names.
Right.
So we've got onabotulinum toxin, which is Botox, been kind of the grandfather of toxins. And remember, all of these, well, most of these toxins now, the vast majority of them are used for medical purposes, actually, and not cosmetic purposes. And that was the case with Botox. It was kind of a fluke that Botox was found to be useful cosmetically, wasn't it?
Gene Crothers,
Yeah.
Gene and Alistair Crothers. Gene's an ophthalmologist, Alistair's a dermatologist, and they were using it for the original indication, which was blepharospasms. And what Gene noticed is that, hey, if I treat the muscles in the glabella, the corrugator and procerus, people are happy and they look better.
Mhm.
So this opened up the world to toxins aesthetically.
Yeah. And toxins are used just dramatically medically for all sorts of different purposes. I
Yeah.
mean, we could go into so many.
Migraines,
Oh
right.
gosh.
And we could get into even what we're seeing now is making people feel better because you're not frowning. You can't be depressed the same. And it's an incredible treatment for depression, anxiety, PTSD, and other things. And it actually even enhances how other people see us when we don't frown. So it's an
Mhm.
incredible, social benefit as well as cosmetic benefit.
I've got a good friend who's a psychiatrist who's been involved with the development of Botox used for depression. And unfortunately, there was a phase 3 trial done for Botox for depression. It just didn't hit the p value. And some thoughts were, well, they had psychiatrists doing the injections who have never touched a patient, well, haven't touched a patient since medical school. And so perhaps it wasn't the
Probably.
right, yeah,
Yeah,
right people
the
doing it.
studies are incredibly positive. There's a study from Walmer and others that
Yeah.
show even with treatment through resistant depression, if you use enough to really knock out those muscles for months, you have tremendous benefits.
And I think that's anecdotally, many of us who do these injections will say the same thing. Many of our patients come back and just say it makes me feel so
Absolutely,
much better.
without question.
And one of the reasons on a skincare podcast we're talking about toxins is because of their effect on skin quality as well.
Mhm.
Lots of data on that, right, Mark?
There is. So it's interesting because you can look at this in a few ways. We've known for years that when you treat the muscles, and I tell my patients it's like paper. When you're folding paper, you get these, heavy lines in the paper.
Mhm.
If you don't fold the paper and you kind of lay them out, the lines get less. And that's essentially how we see the glabella, especially, but in the crow's feet and other areas as well. If you're not contracting the skin, those lines tend to fade to some degree. Now,
Mhm.
there's some interesting data, especially on Daxi as well, that there may be other components as well from the peptide that's injected with it may enhance essentially elastin and collagen production. So there
Ah.
may be other aspects to it as well. But that's what I'm saying. Everything is a little bit different. Each toxin varies by a few different things. As you talked about, there's different molecular potencies, and molecular potency is really the key issue here that we have to think about for toxin. And as I said, there is 3 different components for molecular potency. How much toxin is there, okay? The ability for the toxin to bind. In other words, is it aggregated? Is it
Mhm.
clumped together? Is
Mhm.
it sticking to the side of the bottle? How much is actually there to bind? And the third component is there a way of getting the toxin into the neuron more efficiently? And there are 2 different interesting studies that have been done. First of all, with Daxi, the idea is that the peptide has a charge, and that charge does 2 things theoretically. There are studies that show, but other studies that dispute this. Number 1, it prevents aggregation in some studies, but number 2, because of the charge, it brings the toxin closer to those SV2 receptors, therefore more can get in.
Mhm.
Now, what's so interesting is there was a company, it was just sold fairly recently called FastTox that looked at something else. They looked at postsynaptic inhibitors. And what that tended to do is increase the number of SV2 receptors on the neuron. And if you think about this from a concert model, let's say you go to a concert and there are small numbers of people at the concert, and that would be equated to low molecular potency versus high numbers of people, there'd be more getting through those exits.
Mhm.
But if you have more entrances or exits out there,
Mhm.
those more you'd get a lot more
Yeah.
in a short period of time. And that's
Right.
what this postsynaptic inhibitor fast tox seemed to do. No matter what toxin you used, the molecular potency went up. You got quicker onset and longer duration with exactly the same amount of toxin. So I think in the future, what you're seeing is that we can modulate this ability to get things in and out of the neuron. Now, the interesting thing is we can already modulate this because we know that up to a point, if we increase the dose,
Hmm.
increase the molecular potency, the number that we could do, we get longer duration and a shorter onset. And those go hand in hand. If you think about it, you'll get it in more quickly, but
Yeah.
you get more in so it lasts more quickly.
Right.
Okay. That only goes to a certain point, though. The idea somehow that we can get so much in that it'll last for years doesn't happen. You can only, because of the number of SV2 receptors, you can only get so much in. So I think that what you see is that for almost all toxins, you can take it probably double, maybe a little more, and get a longer duration with almost any toxin. So if that's the case, as we have more toxins, you talked about two that are coming out very shortly, Lativo, which has
Hmm.
already been approved,
Hmm.
okay? And Lativo's claim to fame is it's a very good toxin. They did some very good studies, essentially, on the not only cosmetic benefit, but also the psychological benefit. And I think what you're going to see is it's going to come out at a much lower cost point for Lativo. The next toxin is relabotulinum toxin, which is hopefully soon to be approved by the FDA. That's Galderma's new toxin. That is a liquid toxin. And the liquid toxin is interesting from a couple of different perspectives. Number one, it seems to be a very highly potent toxin, number one. Number two, because of the way it's made in a way that it doesn't ever have to go through the freeze drying process. And so the toxin is much more non aggregated. In other words, there is still a lot more available, even at a certain number of picograms. So it is more molecularly potent. The second part of that is it may be easier to draw up. You don't have to mix it, etc.
Hmm.
So there's some benefits to that that we'll see. It hasn't been approved yet. It's going to be approved soon, I believe. And then we're going to have to see what the price is when it comes out.
Yeah, you make a really good point. One of the things I've always wondered is, for example, many of these toxins come lyophilized, right, as a powder, and you reconstitute them. But you always wonder if there's a gradient in that mixture that you've made yourself, right? Whether there's more toxin at the top or at the bottom, and whether you're pulling up 20 units, but are you really pulling up 20 units or not?
Well, it's interesting you bring that up. The FDA guidelines for this, it's plus or minus 20%.
Mm,
And that's very interesting. It probably doesn't happen in real life, but if you think about it, that's a 40% differential. So
yeah,
somebody can come in at one point in the differential in one vial, okay? And then all of a sudden, the next point, it's 40% less, let's say, and they're saying it's not lasting as long.
right.
So by nature, there is a potential differential gradient in toxins you mixed up. And as you said, people mix it up differently.
Mhm.
They avert the vinyl differently. There's all sorts of things that may lead to ultimately differential molecular potency.
Yeah, I just think this ready-made liquid toxin is gonna solve for a lot of the issues that we have, and some of the issues kind of fly under the radar, we don't really think about them, but they certainly are issues, and whether they're business related in terms of number of lost units because of inadvertent mixturing errors, or mixing errors, or they're truly, patient satisfaction issues where, to your point, we're between injection sessions, we may be injecting up to 40% different amounts of
Right.
toxin. I think that this liquid toxin is very exciting because of that, and I agree with you, the price point is really going to determine the market considerations, but, just from my viewpoint, I'm excited about it.
Yeah, no, I think it's very, very interesting when you see that. So the two interesting things about this, number one is the last paper I wrote, I talked about a molecular potency quotient.
Mhm.
And what that means essentially is, let's say you want to get an effect, okay? Depending upon which toxin you use, you can get that effect. The question is, how much is it going to cost you
Right.
for both you and the patient? So if it's you, what is your profit margin? Okay.
Mhm.
If it's the patient, what are they going to pay? Somehow they may or may not be related. Okay.
Yeah, right.
And that's one of the things that we need to see. Okay, you're going to have this toxin that's going to be more potent, but it's 3 times as expensive as this toxin. That's not quite as potent, but still works. And you could go up on the units. Okay. Which is better to use? And again, remember, all of them work identically. And that's very, very important. Now, what's interesting for the future is if you look at the literature, there are some new things that are going to come down the pike.
Mhm.
There's what's known as hybrid toxins. And
Mhm.
hybrid toxins take, for instance, the heavy chain component from the B toxin and the light chain component for the A toxin, and it's essentially a hybrid toxin. So what's interesting, the reason the B toxin is so interesting is there are different types of receptors, and there are a lot more of them than the SV2 receptor, somatostatin receptors than the SV2 receptors. And because of that, there's many more places, as you said, to bind, and you get much more in the neuron.
So the
So
molecular
this is going
potency
to be in
then.
the future, but what you
Okay.
could see is a lot more ability to go in with these hybrid toxins and longevity. The other thing that's going to happen is there's a type E toxin.
Yes.
Type E toxin is should be approved very soon in the U.S. Allergan has the first one coming out, and type E toxin has a different receptor from there, and it actually has a different light and heavy chain. And what you see is very, very quick onset, but it only lasts a few weeks. It only lasts maybe 4 to 6 weeks. So the thought process or the discussion there is for people who are nervous about using a toxin, they don't want it to last very long. This is something that may, work. But my way of looking at this for the future is you're going to mix these, okay? Like anything we mix. So you use a little type B with some type A, and all of a sudden you have really quick onset and you have the duration of type A as well. So there is going to be a lot of interesting work that goes on for this as well.
Yeah, the type E toxin is really interesting. We were involved in the clinical trials, and we had patients, we injected them at 5 o'clock in the morning, and we followed them for the next 12 or 15 hours. And you could just slowly see their glabellar lines improving over those 12 hours. So truly does, based on my experience at least, it truly does have a very quick onset of action. And I think
Now,
this is totally off label, but I was excited about it regarding scarring, and post-surgical relaxation
yes,
with such a quick onset of action at lasting 3 months, or excuse me, three or 4 weeks. And then, for pain relief and related to herpes zoster, for example. I
yes.
mean, there's a lot of opportunities for a short-acting, short-duration toxin, and I think many of our peers really look at this with kind of a little squint, and they kind of don't understand why they would bring this out to the market, but I certainly see opportunity for us to use this, and maybe it's in the mixing, like you said.
Yeah, oh, no, no. It's exciting because it gives us a new tool. And as you said, so if you remember, and you've kind of laid this out, toxin is good not just for the lines here, the lateral canthal lines, the
Mhm.
frontalis and mentalis. I mean, there's a lot of different things cosmetically. However, what's interesting is there's great data on scars, post-surgical scars. If you're doing an excision on the forehead, for instance, you get a better scar if
For
you
sure.
use the toxin first,
Mhm,
so you're not getting that movement. And it only makes sense. The movement is
mhm.
going to affect the way the scarring heals. So there are benefits to that. There's also benefits for things like pores and the overall skin quality that's been looked at without question. Then there's benefits for acne and rosacea. There's so many different interesting uh, side effects
Yeah.
to toxin from that perspective. We're just beginning to look at that. And what's interesting is that with toxins coming out that are lower cost, we may be much more inclined to use it in these aspects for the decolletage, for other
Yeah.
areas of the body that we before would have been very expensive, but now, hey, it's something that patients would like to do and it could be more affordable.
Yeah, there's an intradermal technique of injecting very small doses of Botox that helps to improve skin quality, what we were talking about before. One of the things it can do is relax. It helps with very, very fine lines, helps
Yep.
increase luminosity and radiance on the skin by reducing sebum production. And then there is some thought as to, collagen production as well and basement membrane integrity with the
And
use of
hair growth.
and hair
There's
growth.
a
That's
couple of
right.
studies on
Mhm.
androgenic alopecia. So
Yeah.
again, we've got some very interesting opportunities for toxin for the future.
It's a miracle drug, isn't it? It really, like, I don't even know that we've touched the surface on all the opportunities that's available with this
No,
drug.
I agree. But to me, what is most interesting, and I've published on this, is the effect on the psyche. So
Yeah.
what we know is that there's a feedback mechanism from the glabella especially, and this is something that Eric Finzi did years
Mm.
ago and has been looked at many ways by a number of different investigators, but it works through the amygdala. And what happens is that if you can't frown, you're not getting the feedback to be sad. And it's a very interesting phenomenon because it works in a way called mirroring. So when somebody around us frowns, we automatically frown as a response to that and feel that unhappiness. Some people will say that's the mechanism for empathy. I don't believe that. I think you can still listen to them and have sympathy. You don't have to have the pain to feel another person's pain, so to speak.
Right.
So what happens is that you all of a sudden have a world where you're not getting as much frowning and people are happier. What's so interesting though is if you knock out the lateral canthal lines, okay, which we do very often, it totally abates that. So it doesn't allow us to have that happiness
Yeah.
because the lateral canthal lines are associated with smiling. And you want to have the smiling there. So, what I do on a number of patients is I treat them for their psyche and their people around them rather than aesthetic. So, what I do is I treat the glabella and I treat the lateral orbicularis. So their eyes open up, they
Open.
still can smile from the lateral canthal, and they won't frown. And what this seems to do is it even enhance the psychological benefits for them and the people around them.
Yeah. And just to reiterate, if you treat the glabella, you get the improvement in overall mood. If you treat the glabella with the crow's feet, you lose that improvement. It's
Absolutely.
so in that study I found so interesting.
And
And
if you
so I
just treat the glabella, I mean, the lateral canthal, you have less happiness. It goes
yeah,
down.
it goes
Now,
down.
there are so many other this study, and this was such an interesting study. It actually went into the issue of women's orgasms. Okay, and
Huh.
the study showed that if you treat the lateral canthal lines of the glabella, women don't enjoy their orgasms as much. And this is actually, and it's funny because whenever I give a lecture about this, I ask the audience, nobody seems to raise their hand saying their orgasms are affected. I don't know. But the bottom line is that it shows that there's such a connection between how we feel and how
Yeah.
we experience things and our facial expressions. It's just it's incredible to kind of open up this whole world
Very.
of how we modulate our feelings and how we can modulate based on what we do to individuals with toxins.
Just again, just to round it out with skincare, there's a lot of products now that use neuropeptides, which are, we call them Botox mimickers, but really what they do is they try their very best to reduce the activity of muscles and help to relax the skin at the very highest surfaces, which more than make you feel happy, they really just improve the
Right.
tone and texture of the skin, right? That's when I was talking about
Absolutely.
intradermal Botox, that's the idea with neuropeptides. But
And I think, to your point, the most important thing is toxins are a part of what we do.
right.
Okay. They are by far the most common aesthetic procedure that anyone does. That goes without saying.
Mhm.
And obviously, they're used more and more for things like masseters. And
Mhm.
masseters can be both aesthetic and certainly for TMJ and things like that, and other
Absolutely.
treatments as well. But with this, we still want to use our fillers when we need to, use our devices, and certainly use our skincare products. I think this is something that is, a combination, and of course, our sunblock. We have to be our
Yeah.
dermatologist
Ooh,
first. That's important.
we almost
But
lost our licenses there.
exactly. But I think that, this, this is so great. And part of this, Science of Skincare Summit, it's so wonderful because it melds all these together. And I'm looking forward to next year because, this is this evolution that's occurred in terms of both topical products and
Mhm.
toxins and, devices and
Mhm.
everything can really take us a whole nother level in terms of what we can do for our patients.
Thanks, Dr. Nestor. As always, I learn something every time I talk to you. So I so appreciate your time.
It's my pleasure. Thanks so much, Ted. I look forward to seeing you soon.
That's great. So this is Skincare Confidential. My name is Dr. Ted Lain. I've been interviewing the wonderful Dr. Mark Nestor, who is in Florida. Thank you so much for listening. Please subscribe and tell your friends all about it. And until next time.